Hello, I'm Dave Alley with KCOY 12 Central Coast News. Today is the Day of Hope benefiting Marion Cancer Care and Mission Hope Cancer Center. Volunteers were out this morning selling a special edition Santa Maria Times Day of Hope newspaper to help raise money for Marion Cancer Care. We want to make sure you still have a chance to make a donation of any amount on this very special day. We're about to re-air a 30-minute special we produced on the opening of Mission Hope Cancer Center so you can learn everything about what this hospital has to offer. So enjoy this special rebroadcast on Mission Hope Cancer Center and call the number on your screen to make a donation.
Hello, doctor.
All right, pleasure having you.
Thank you. Thank you for the tour.
No problem.
Good. Are we ready?
We're ready, and let's do it. Take a look inside. So we're starting here on the outside of the Cancer Center. So this is our 44,000 square feet building, and this will be the entrance that most people use coming in, and we'll circle around to this area here.
And as I understand it, you've already started treating patients here in Santa Maria.
We've started treating the medical oncology patients, which are the patients that are getting chemotherapy, and the radiation therapy should start within the next month, and CAT scans, mammograms, all that stuff should be coming on board within the next month as well. Wow. So this is the lobby here where most people will come in initially to start. We have volunteers that work here every day from Marion Hospital. And this is where people will go to the rest of the building, and we can start here at Radiation
How did you come up with the
Oncology.
name Mission Hope? I'm just curious about that.
We thought a long time about what to name the place, whether it was just a regional cancer center or just the cancer center, and we thought about it in two perspectives. There are a lot of missions up and down the coast, obviously part of our heritage here in California. We don't actually have a mission here in Santa Maria, and our mission was to provide this kind of care for the patients.
And hope for the patient as well.
And hope for the patient. So when we put all those concepts together, that's what we came up with, Mission Hope Cancer Center, and the symbol just kind of symbolizes the ocean, the greenery, and the blue skies that we always have here in California. So that's how it all came to be.
That's great. So, really great.
So through this way is the Radiation Oncology Department, which has not started seeing patients yet, but hopefully our facility will be ready to go and see patients in about a month's time. We'll go in and see the linear accelerators, which are now being installed. And this is where people will wait for their appointments to see the physicians. Through that wall, that's actually a temporary wall which we can open up and make this a larger facility. Our conference room is located behind that wall, so that in the evenings we can have support groups open up that wall. It's attached to a kitchen. We can have talks and support groups and other physicians coming to talk to the community through there. So
truly amazing.
So
it really is.
We'll see how functional it is.
And your mural on the glass is unbelievable.
A friend of mine, Chris Burkhart, a friend of mine from church, is a surfing photographer, and he had a lot of these pictures on his website and at his access, and so this is a new process. I don't know anything about photography, but they tell us it's a new process where the picture is actually etched on the glass.
I've never seen it before, and it's really, you know, when you look at it, you can't believe that it's there.
And it gives you a different feeling.
Yes, it does.
In the room, but allows a lot of light to come through. So, all right. We'll go on through here. So what we did out here was created what we call our secret garden. So we can still see the picture of the lobby.
That's amazing, though. It's on both sides.
It's on both sides. So what we can do here is a spouse that's maybe bringing their wife or their husband to radiation oncology for that 15 minutes can sit out here, read a newspaper, have their coffee, and the patients themselves don't have to necessarily go through the lobby. They can actually come right through the secret garden here and directly into the check-in area for radiation, so they can really make their daily experience a quick 15 minutes, and it doesn't disrupt their day as much. So they're in and out quickly, and obviously the plants will grow in a period of time, and it'll be comfortable to sit here. And this part of the building's shaded from our Santa Maria winds that happen 2 or 3 days a year.
Yeah,
so
I noticed you have it on the side where no winds come
yeah,
toward
so
you.
they'll be protected here.
Yeah,
but,
that's great.
So some of the patients will actually come right through here and then right into the check-in area for radiation oncology. This will be the check-in area, which is obviously not functional just yet. This will be the area where patients get their actual radiation treatment on a daily basis. They'll go into the changing rooms and then come out into this area. This is Dr. Ketting,
Dr.
who is
Ketting, nice to meet you.
our main radiation oncologist in town here, so he can explain us a little bit better about how this area works.
This isn't all our department, but it's really the center of operations, as you can imagine, every day, 35 days in a row for a patient. And it's a very high-tech area, but we try to keep it high-touch as well, which is, of course, the goal of the whole cancer center. This is just our control area, and as you can see, we have 6 monitors, because there's just tons of computing horsepower there. This could probably send the shuttle into space and back a few times. But this is just the control.
The poor guys on Apollo didn't have that good of a computer.
They did not. No, Apollo 13, they had to think on their feet. And then the treatment machine here is a linear accelerator. It's technology that was developed in...
Oh my gosh. Oh my gosh.
The 1950s, and has been continuously updated to be a completely computer-controlled machine that can account for all sorts of motion. And in some ways, we think of this machine as something that can kind of chase you across the room if you move and still.
It looks like it could.
Yeah.
It is absolutely unbelievable.
And just to clarify, what you have is radiation, very precisely metered and controlled, coming out of here.
Is it pinpoint? I mean, can you take it down to a pinpoint?
If you need pinpoint, we can do it. If you need a wider field of radiation, we can do that. This will do just about everything that's out there.
In other words, it does the least damage to the good cells that it possibly can.
It's all about targeting the disease and avoiding damage to any of the normal structures. Part of that process is this part here, and this is a modified CT scanner. So when we put the patient on the table, we'll do one rotation of the machine around them and actually get a three-dimensional view of their anatomy. And if they are 2 millimeters off from where they need to be, the machine will move and get them perfectly on target.
My God.
And that's a semi-automated, actually kind of an automated process. Nobody ever wants to have to use it, of course, but, we're here
if it's there, that's what it's there for.
Yeah.
We want to be sure and use it if we have to. 3 to 4 minutes for a treatment.
Yeah.
Unbelievable.
It'll probably take about 2 minutes to do the initial imaging, get precisely on target, and then another 3 to 5 minutes to do the treatment. So all told, probably door to door, it may be down to 10 to 12 minutes.
My gosh, like a cup of coffee.
Yeah, and hopefully it's that pleasant.
Yeah, let's hope so.
We have another machine over here that we brought over from our other facility. So these machines will not match in capability, are matched in their energy. So if we should have a problem on one machine, patients can still be treated over on this machine and not miss any treatments. We find that being very helpful. So you can basically take one computer treatment plan from this machine, move it over to the other one, and just treat.
And where is this machine built? I mean, is this a American machine or is it European or?
Follow the 101 right up to Palo Alto.
Oh my gosh.
Varian Medical Systems.
You're kidding me.
American made
right
all the
here
way.
in California.
And guess what? We're selling them to China.
Atta babe. Let's do it. We'll take their money anytime we can.
Absolutely. Yeah.
Bring it to us. Thanks again, doctor.
All right, thanks, guys. You can take advantage of putting new technology in when you're starting from square one rather than having to change things out.
Right.
And I think the advantage of having Dr. Ketting's group, Coastal Radiation Oncology, in our group is it allows us to take advantage of their strength in the market and allowing us to upgrade that technology when on our own we probably couldn't do that. But well, speaking of technology, let's go down the hall and we'll look at our next technology. This is the imaging department for the building. So Marion operates and runs this part of the department. So people will actually come in from their own entrance here, which will be marked as the imaging department, so they don't have to funnel their whole way through the building. We have a separate waiting area for them here, and then they'll come right in here to the CAT scanner. And
well, it's really obvious that you really thought this all out.
we try to think about it from the patient perspective, and we actually have had a lot of input from patients so that we could get a feel from them what makes this whole process difficult and what makes it a lot easier. So I'm going to introduce you to Dr. Sonnabend, who's one of our radiologists here in town,
Nice to meet you.
and he can fill you in a little bit about the equipment we have here.
Yeah, welcome. Well, what we have here, we have twin suites, and in this suite over here, we have a PET CT scanner, which is a way of imaging patients with cancer to look at the metabolic activity of their cancer to see how it's responding to treatment. And this fuses positron emission tomography and CT scanning.
Easy for you to say.
Absolutely.
Tough for me to say.
I've practiced a lot. And this unit over here in the other room is a straight CT scanner for routine imaging of patients. That does not have the nuclear medicine capability of fusing with the PET images. But both of these are state-of-the-art scanners. It's fantastic to have them under one roof here, integrated with our cancer program. And no longer will we have patients going onto a trailer, a portable system, which is what they've been doing up till now for the PET CT.
And this is the one that goes bump, 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 bump.
No, that's the MRI.
Oh, is that the MRI? That's the one I had, was an MRI.
This is quick, this is quiet, it's a lot easier to go through than an MRI, and we've tried to make this very aesthetically pleasing for our patients. We have the light panels on the ceiling so they can kind of get a sense of being outdoors, something very pleasant to look at.
Oh my gosh.
And with the help of our community and our hospital, I mean, here we are. And I think the days of people leaving town to go for care at the big universities,
they're over.
It's over, absolutely.
They're over.
Absolutely.
Yeah. Well, it really makes you proud to be living in Santa Maria, to have people like yourself and Dr. Dickman and Dr. Ketting to be able to give this to the people of Santa Maria. This is literally a gift to the city of Santa Maria.
Well, I've been serving here at Marion Regional Medical Center for 16 years, a proud 16 years, and for all this to be going on right now, I am so excited.
You are.
So proud to be part
I
of
can
it.
tell.
Yeah.
I can tell you are. Yeah, it's amazing. It truly is.
Well, we can actually continue the rest of the tour and catch up with Dr. Sonnabend one floor up, where we can look at some of the breast imaging department that's going to be relocated into our facility if we want to come out through this way.
Upstairs.
I'll be there.
So we'll take a quick look into this area. This is not an area that patients usually would travel to very much. This is all related to the actual CAT scanning department. But we'll take you through right down to the end here. This whole section of the building is more or less our cancer support area. So we have located all of Marion's cancer support area into this one building. So people can come in through, again, a side office, meet a receptionist here, and part of cancer care is in having multiple disciplines involved. And so all of our patients, we would like to have a dietitian, a social worker, nutritionist, all of that involved. And so we've created
full gamut of treatment.
because eventually they all need it, or they certainly need education to go along with whatever treatment they're getting, and that's helpful. So down in this area is where we're going to have these things. We have nurse navigators, which help them through the whole process of their whole cancer care. So some of the support services are located here, where we have our Look Good, Feel Good room here, which is really where patients come in and have their wigs fitted or makeup, and they have training sessions where how to deal with baldness and some of the issues that they have. We might be treating them once every 2 or 3 weeks, but they have to live with the effects of the treatment. And for women, obviously, hair loss is a big thing. And
well, it's a big one for men too.
It is. And so this is a way for us to be able to once again make it so they're not constantly going out and having these services done somewhere else, but they can do it right here. So we'll also have some massage therapy here. You can see in that room. We're going to hopefully have acupuncture. So we're trying to include all elements of care of the whole body, and again, in this one facility. Some of these programs are going to take some time for us to get fully developed, but certainly are a work in progress.
You're working
towards, exactly. So this portion of the building is not so much patient related, but more for us, the physicians. So every week on Tuesday, a group of us, Dr. Ketting, who you met, Dr. Sonnabend, we meet and discuss essentially every brand new diagnosis every week. So we have about an hour and a half working lunch on Tuesdays, go through each one of their cases from their pathology to their films to how they presented, and we get to look at the films, we get to look at the pathology under the microscope on these screens, and then we can make a recommendation on how to move forward. Now the patients, sometimes we haven't even met them yet, or we're about to meet them, or maybe we've just met them for the first time. But it's very reassuring for them to know that we're going through their whole case and figuring out what the best approach is. So this is where we'll do all that. We'll have all the technology set up so that everything's easy and available for us on the screen, so that we're not looking through microscopes anymore, but everything is digitally done. Through that wall takes us back into the main lobby, which we discussed last
Oh
time.
yeah,
is
that's where you can
we
open it up.
Right. So on the other side of this wall is a little kitchen area, so that's where we can have our nighttime conferences.
Unbelievable.
And then what we can do is go up these stairs here and
right.
take us to the second floor. Okay, well, we've arrived on our second floor, and this is actually a general waiting area for patients that will wait to see surgeons and breast imaging and whatnot that we'll see on the rest of this floor. It gives us a good opportunity to see just how close we are to the new Marion Regional Medical Center. And that was one of our important parts of the puzzle as well, is that we as physicians are going back and forth to the hospital on a daily basis, sometimes 2 and 3 times a day. And this allows us to be able to not have to get into our car every time, be very close by. And if there are some procedures that the patients need to have in the hospital, they're very close for us to make arrangements for that to happen. So we feel lucky that not only do we have a new cancer center, but we have a new facility opening up in the next month as well. So really,
and you have a great relationship between the two as well.
We have a great relationship between, this is really a combined project between the hospital and ourselves, and it's going to make a big difference again to the patients, because we're now delivering quality care not only as outpatients here, but as inpatients in the hospital. So
tremendous.
So if we head down this way,
right.
The breast imaging department is an excellent department already in the hospital, and we did not want to recreate that, but rather just move it. So in this area, we'll run back into Dr. Sonneman, who will take us through
again. How are you again?
Nice to see you again.
So he'll take us through a little tour of the breast imaging center.
Sure, this is Marion's Breast Imaging Center, which this is the new home. We have been here on the campus of Dignity Health for many, many years, but these are the new digs. And this is our Hologic breast biopsy table for stereotactic breast biopsies. And this is replacing an old unit that we have in our other office. And it's brand new, state-of-the-art, and this will allow a lot more to be done here at this facility. There are women that we have sent to other facilities in the past because our equipment just wasn't able to accommodate them. And this table is really going to broaden what we can do here as far as biopsies.
Truly amazing.
And all of our rooms here will be state-of-the-art digital imaging for mammography, and we'll have ultrasound here as well. And it's wonderful to be here under one roof, where we can communicate very easily with the breast surgeon, with the radiation oncologist, with the oncologist, all of the ancillary support team, the social workers, and such. To be here under one roof and to be able to coordinate everything is going to be so much more convenient for patients and their family.
Yeah.
Very
Well, and then they don't have to go out of town to do this.
No more.
No.
Yeah.
Great. Unbelievable.
Pleasure to share this with you.
Well, thank you, Doctor. I'm glad to see this.
Department that we have here is our research department, and I think this is an important part of the building at this point. Our practice is a UCLA affiliated practice, and so what that means is we've been able to enroll actively patients on trial. We have about 27 patients that are actively involved in a clinical trial right now. So years ago, if they wanted to be involved in a trial, they had to go down to UCLA, and that might mean 2 or 3 trips a week on that 405, and that's not very pleasant at all. There are certain people that get to a point in their treatment where we don't have the next thing to offer, but we know that there's a good drug out there, or socially we just have a question that we want to answer. Is treatment A better than treatment B? And we happen to have a trial open for that. So we currently have the ability to put people on the exact same trial that they would be on at UCLA, but do it all here, never have to travel to UCLA, get the exact same treatment that they would, but we've also got the cooperation of UCLA. We can pick up the phone anytime, talk to the main investigator involved in that trial, and the patients can get it all done right here. So UCLA is a large group. They've got about 40 or 50 practices in their network. For the last 3-4 years, we've been the top recruiters in that network, just because our community really wants to take advantage of that research opportunity. And in some patients, it's made a huge difference. They are now being able to say years later that they were part of a study that is now considered standard, but they got to get that drug before anybody else could. It's a very big part of what we do, because the field is changing so quickly that we want to be able to offer new drugs all the time for the patient. So we were cramped into a very small space. Some of the files that are kept on each patient that's on a trial ends up getting a binder about this big. And there's usually 2 or 3 other binders that go along with this, and they are kept on site for anywhere from 5 to 15 years. So you
Oh my
need a
gosh.
space that you can accommodate this.
That's for sure.
And the hospital's been very helpful in terms of helping us set up this area for our research team to work through.
Amazing.
So we'll leave this area and go back to a patient area.
Okay.
We can go up to the 3rd floor, where is the medical oncology department is housed. So people come here for the chemotherapy part and follow up, and so we'll go through this door. This is our check-in area. And again, what we've tried to do is make it as convenient as possible for our patients in terms of getting some of their care done that doesn't necessarily involve the more aggressive part of their treatment. So for patients that come in to get laboratory work done, which is a part of our job every day, basically, all of our patients that are getting chemotherapy need some blood work done first. So they will actually be able to come right off the elevator, sit in this little sub-waiting room and have their blood work drawn here. So this is our Marion lab, now runs this
And your
lab right
views are
behind us.
gorgeous out the windows.
Yeah, the
People
3rd floor
can-
is especially nice, and we'll see that in our chemotherapy suite. But again, we've tried to bring the outdoor lights so that it doesn't feel like you're in a hospital
Right.
or a clinic setting as much. Now, part of our treatment for patients is they often require multiple shots. Just a little shot they get underneath the skin. So we probably give anywhere from 25 to 30 shots a day. This is where Chris in our office gives the shots here.
Little needles.
Little needles,
Not
just
big
underneath
needles.
the skin, and it's
Okay.
basically, you know, it's a 2-3 minute event, obviously, which doesn't take a lot of time. But what we try to do is create an area where they can come in off the elevators, come straight to that waiting area, have Chris give the shot, and go right out again without going
they're
through
done.
the fuss of going through the entire office and things like that. So it makes again the process as simple as we can without having long delays.
Oh, there's the enemy of myself, is the scale.
Right. Well, in our population, we're worried about keeping weight on sometimes
right?
more than off. But, so these are our typical exam rooms here. Nothing fancy about them, but again, trying to create some light. We need to go in here to turn the light on, actually, but trying to create a little light and have a feeling where it's not again
Right.
so clinically cold.
Yeah.
And
Because
just a
most
warmer
places you
environment.
go, there's no pictures on the wall. It's just
Right.
paint.
But
and-
unfortunately, our patients, if they're getting treatment, they can be here every 2 weeks or every 3 weeks for months at a time. And so we want to try to make that process, first of all, spend as little time here as possible getting in and out quickly, but at the same time, give them an environment that's not as stressful or they're thinking about treatment the minute they come in. So we can go down this way here to our other treatment area. So the way our field works is that patients that are coming in for chemotherapy will initially come in, see the doctors there to make sure that they're all set to start their chemotherapy that day, and then we will walk them through to the treatment area, which is our infusion suite. And we've, again, tried to make that as pleasant as possible, even though
it's
not
no
a
fun.
pleasant, it's no fun.
It's no fun.
And some of our patients will have a fairly easy treatment in the sense that they're here for 15, 20 minutes.
Is that right?
But others can be sitting here for 8 hours
Oh my
at a
gosh.
time. So we try to make isolated areas here where if people don't want to be in a bigger room, they can have more or less of a private area. We've actually even got a little veranda area where their family members can sit outside and just get some fresh air. We have created a little nutrition area here where the patients can get a little something to eat, or their family members can get a little something to eat because they're here for such a long period of time. And then we've created an area that's nice and wide open. We've done some extra
Beautiful
things.
views.
Beautiful views. And again, if you look out here, we'll see the hills. And depending on what time of the year that is, they could be red, they could be green, they could be brown. And again, just try to create not a clinical experience, not feeling like they're shoved in a closet getting chemotherapy for 8 hours, but rather in a warmer environment, in a non-hospital type of environment, and just try to make the experience a little bit more pleasant for them. This is an area where the nurses have to be watching the patients closely because they're getting drugs that can have side effects, and so we've created an area where they can be looking at their computer monitors but watching the patients at the same time. And that's why we don't have individual treatment rooms, because the nurses have to keep a
They have
close
to be
eye
right
on
on
the
the
patients.
ball.
Right.
Sure.
So we've done a little extra things that at the time of construction you don't know whether they're going to work or not, but the tiles are a little more soundproof tiles, and the flooring is a little spongier for the nurses and also sound absorbent. And it turns out that it's actually worked pretty well, despite the fact that the rooms large and we can have 15, 16 people getting treatment
Wow.
here at the same time, it's actually turned out to be pretty quiet and comfortable for the staff to work in and the patients to work in. Occasionally we do get some sicker patients that require more than just a chair, but rather a bed. So we've got a couple of rooms here where the patients can actually have a bed and they can be here for 6 or 8 hours or whatnot. Not intended to have anybody stay overnight, but certainly some of our patients don't feel that well during the treatment, so it allows us to still be able to keep our eye on them, but have another opportunity for them to be somewhere other than a chair. So this, unfortunately, is where a lot of patients spend their time. So we've spent a fair amount of our time trying to make this look as good as it can and be as functional as it can to get the patients in and out, but give them an environment that's a little bit more pleasant and a little less clinical than it's been in the past.
It's truly, truly something.
And we really wanted to take advantage of the views.
You have to be very, very proud of this, Doctor.
Yeah, I'm happy the way it's turned out. Obviously, we've got a long way to go in terms of getting everything set up exactly the way we want to and having all the departments set up. But I think we're moving in the right direction. And what it allows us to do, I think, for the future is to keep pushing the bar, keep pushing the envelope, bring better people, better trained physicians, and just continue to expand our services so that we're constantly on the cutting edge. And I think that's all we're all looking for, whether it's a patient or the physician, is to be able to do the best we can. It's not an easy business because some of our patients don't do as well as we'd like them to do, obviously, but I think keeping them here and treating them as humans and patients that have families and don't want to be spending all their time on the road, especially in those circumstances where their time has become now extremely valuable. If there's a limited amount of it left, then we want to focus on that. And I think this is allowing us to do that. It's something to build towards for the future, and hopefully as the field changes, which it does, we're prepared to handle some of those changes.
That's so good. I'm so proud that I'm the mayor of the city of Santa Maria at a time when we've literally made a quantum leap in healthcare here, not only from your particular Mission Hope, but Marion Hospital as well. It's amazing what you have accomplished.
Well, and I think the community has been a big part of it, from the community of our patients telling us what they want, but also from the community of people that have helped us put this project together. As you know, it's all community owned, basically. I'm the only physician that currently is an owner of the facility. Most of the other owners, or all of the other owners, are actually strong community members.
Yeah, people I went to school with.
People you went to school with, people that we see playing baseball on TV
all the time.
and whatnot. Right.
That's
so
right.
They felt very strongly that this is something we needed here, and at a time where nobody else was willing to take a risk from a business point of view to create a structure like this, they were willing to do that, and I think that's what's made it possible.
Well, Santa Maria is a very, very generous community. A very compassionate community, always has been, and so I can see why it's here.
Yeah, it's going to be.
And I want to thank you for taking me around and showing
my pleasure.
me.
My pleasure.
Thank you.
Thanks
Doctor.
for coming.
We hope you enjoyed this special rebroadcast on Mission Hope Cancer Center. If you'd like to make a donation on this Day of Hope, please call the number on your screen. Thanks for watching.